My name is Maryam Zamani. I'm an oculoplastic surgeon and aesthetic doctor. I work here in London in Chelsea at the Cadogan Clinic on Sloane Street. And as you can tell, I'm an expat from America, and I've been here for about 11 years now. My Tri-Eye treatment was created to help look at the tired eye, and there are many factors that contribute to a tired eye. So when we're young and we have this fabulous collagen and all the energy in the world, if we have a few hours of sleep, somehow our skin manages to regenerate in that little bit of time. But as we get older, the fullness of our face starts to change. The bones start to move slightly, the musculature, the fat compartments, and the skin itself begins to change. And so whereas before we had a natural smooth contour from the eyelid to the cheek, it becomes a little bit more elongated, and you can tell where the eye ends and the cheek begins. Sometimes people complain of tired eyes with bags, dark circles, puffiness, a little bit of fat coming forward. And that's one of the number one complaints of people and individuals who come into my office. They always say, oh, I look tired even if I sleep 8 hours. And it's really, while there are some external factors, a lot of it is intrinsic aging. So what can I do? I can help those fine lines and wrinkles. I can help that volume loss. I can mask sometimes that puffiness, and I can help just generally improve the skin texture and smoothness and luminosity. So what does that entail? One is to treat the little fine lines and wrinkles around the eyes with something called botulinum toxin. This works to temporarily paralyze the muscles that cause contraction around the eye. People sometimes call them the crow's feet, and sometimes those crow's feet become etched into the skin, so they become a little bit more prominent. So even when you're not smiling, you see the fine lines and wrinkles that oftentimes can be bothersome to us women and men. Then from there, I also add hyaluronic acid. That is a filler. It does exactly what it says it does. It fills the space with a little bit of hyaluronic acid. That is a natural occurring substance in our body. We have the enzyme to break it down. The way this has been formulated, I particularly like the Juvederm range. It's formulated to last between 12 and 18 months. And so I use very strategically placed micro droplets of hyaluronic acid all along the border of the lower eyelid, and sometimes around the lateral orbital rim because we lose some volume there. And that just functions to restore a little volume, and so immediately you can look more rested. Sometimes in people who have a very little bit of fat prolapse, which is a bit of puffiness underneath the lower eyelid, I can mask that with hyaluronic acid strategically placed too. So there's a few things that I can improve with the hyaluronic acid. So that's step 2. And then step 3 is to address the skin, and I address that with a number of different procedures, and it's very tailored to the person who's coming in. So whether I use a fractional ablative laser, which creates tiny microcolumns of injury that then tells your body to make new collagen, that's great for tightening the skin. Sometimes I use Ultherapy, which is a ultrasound technology to help tighten the skin around the eye to just give you a little bit more of a refreshment and rejuvenation. So it's very tailored to the person, but it's to address not just the skin, but the muscle and also the fat or changes in fat and bony changes in the eye area. So that's my signature Tri-Eye treatment, and a very high satisfaction rate. It lasts for about, parts of it last between 3 and 5 months, the toxin, but the filler lasts quite a long time, and so do the other technologies. So it's a very satisfying procedure for me to do and for my patients to receive. Tri-brow treatment is another treatment that I do because also as we age, the brow changes dramatically, and so it started off as a sort of offset of my Tri-Eye. And as we all know, the eyebrows basically frame the face, and so if you have beautiful placed eyebrows along the orbital rim, which is this bone right up here, you tend to look more natural, more alive, and just fresher. As we age, unfortunately, that begins to fall. We lose a little bit of the fat component up there. Some individuals have hollowing in the temples and also on the lateral orbital rim, which is this area right here. And so they just look tired without really knowing why they look tired. It's not like the eyes where you can see, oh, I have dark circles. It's just there's an imbalance in the proportions of the face. And so just doing small tweaks in the brow area can also really improve just the general aesthetic and making you feel a little refreshed without looking different. So what I do there, again, I try and lift the brow, and I accomplish lifting a little bit with botulinum toxin to help lift the eyebrow on the lateral bits. I use Ultherapy and ultrasound treatment to also lift that area. It's been FDA approved to give 1 to 3 millimeters of lift of the brow, which is pretty significant when you're speaking about small quantities. That can, in addition, help to lift the extra skin that people often complain of as hooding of the eyelid. So you can get a nice lift without really any downtime and just, one treatment. So that lasts about 1 year. So it's a really excellent treatment for lifting of the brow area. And then finally, I treat the area with some hyaluronic acid. So the fat compartments in our face change as we age, and so adding a little bit of volume where volume has been lost is really important. So it creates a more harmonious look. So those are my signature tri-eye and tri-brow lifts. In general, obviously, good nutrition is really important in maintaining complexion, glowing complexion. Exercise helps release stress hormones, helps you sleep better, gives a little bit of oxygenation to the skin, and it has a lot of obvious benefits that we know about. So those are two big things that can help you look a little bit less tired. Hydration. If you're suffering from allergies, oftentimes people don't realize that they have a small allergy to whether it's pollen or dust, and they can cause something called allergic shiners, where you look like you have dark circles, but actually it's your body's response to allergies. So just taking an antihistamine sometimes can be a big improvement in the appearance of the eyes and looking and feeling tired, because when you're suffering from allergies, you also feel very drained as well. So those are my 3 big ones. And of course, skincare. I think it's really important to invest in quality skincare. I don't think you need lots of products. More does not necessarily mean better. It just means to have the good ingredients that are good for your skin type.